Okay. Good evening, everyone. The month of October is observed as the World Stroke Month globally. And October 29th is observed as the World Stroke Day. The prevalence of brain stroke is quite high, and Act Fast page wishes to spread as much awareness as possible through its series of FB Lives with experts on strokes across India. Today, we bring you Dr. Sandeep Borse, consultant neurologist, Jahangir Hospital, Pune. So, today we learn from him on stroke and its risk factors. Hello, doctor. Thank you for joining us today.
Hello, everyone. Good evening.
So, doctor, first off, can you tell us what exactly is a stroke and why is it so dangerous?
So, see, stroke is in general terms is a paralysis, like one side paralysis of the body. The it is happen. Stroke is the stroke is very common in India. It happens because of poor blood supply to your brain or cut off or because of clot. There is a blockage in the artery. So the blood supply of the one side of the brain is diminished or reduced and the symptom develops of that particular part.
Okay. And why is it considered dangerous? Is it fatal? What
So,
can it
yeah.
Sorry, doctor, your audio is not very clear.
Of the patient. And if it now, is it clear? Is it clear?
It's better. It's better. Yes.
Yeah. So, yeah, if it happens to the one side of the brain, with the major artery supplying to the brain, like carotid artery, if it is blocked, it may lead to a large stroke or large damage to one side of the brain. So it may lead to a patient may become comatose and he may die because of increasing pressure in the brain. Or if the clot happens to the area of the brain, which is a small brainstem area, which is back of the head. So if it is damaged, then patient may be paralyzed for whole of his life, and he may not able to move all of his both legs and both hands. He may be bedridden for his life. We will lose the is a stroke. What are the advanced go to the doctor? It is very much important to know about the symptom of stroke.
Okay. So what are these symptoms exactly? What happens when a person has a stroke? Sorry, doctor, I don't think you are audible or even visible. Are you there, doctor? Okay, I think we are facing some minor network issues, so I'm sure the doctor will join us back very quickly. But I would request our viewers not to go anywhere. The doctor will join us very shortly. Hi, doctor.
Yeah, sorry, I changed my device because some network problem was going.
No
Yeah,
problem.
I hope you can hear me.
Yes, yes. So, doctor, I think you already spoke about a stroke and why is it dangerous. We were talking about the symptoms now. So, if you could give us some insights into that.
Yeah, symptoms. So stroke is very common. Everybody should know if it is happening to your neighborhood, to your family member. So you should immediately get attention. It is a stroke. So what are the stroke symptoms? Stroke symptoms can be facial deviation of one side or muh teda ho jana, slurring of speech, and sudden onset hand weak, one side of the hand weakness or leg weakness. So the short form we very well known use it as a fast, FAST, fast. F for facial deviation, A for arm weakness, S for slurring of speech, and T for time to call to the hospital. So it is FAST, fast. So symptoms, other symptoms can be sudden onset weakness of leg, sudden onset headache and vomiting, sudden onset double vision, sudden onset difficulty in walking or imbalance, sudden onset tingling or numbness in one side of the body. These are the various symptoms of stroke. So stroke can present like anything, like sudden giddiness or vertigo or spinning sensation with imbalance. This can be a symptom of stroke. So you should know this. If the patient develops or if anybody develops these symptoms, they should come to the hospital as early as possible.
Okay. And can a stroke happen to absolutely anyone, or is there any age group that is more susceptible to it?
No, there is nowadays there is no age group. Even pediatric or small children can develop a stroke, but reasons are different for every different ages. Like old age person, stroke can develop uh, due to the where it's clotting in the major vessels. Reason can be head injury, reason can be dehydration, reason can be some high cholesterol, high BP, and high sugars in the blood. So these lead to the clotting of the blood vessels. Even adult, young age group, adolescent group can develop stroke symptoms. So you should be aware of the different stroke symptoms, and it can happen to any ages because of the sedentary lifestyle, smoking, alcohol. The young age people are also getting stroke.
Okay. So, Doctor, you already spoke about the risk factors actually. If you could, are there any more apart from these, or if you could just
Yes, yes.
summarize the overall risk
Yes.
factors?
The risk factors are different. So first of all, most common risk factor is the age. Advancing age is a major risk factor. Secondly, if your sugar is very high, if you're a diabetic person, and if your sugar is very high, that can lead to a future stroke. If your BP is not under control, it is always on higher side, more than 140 by 90, then it may slowly damage your blood vessel, leads to clotting in the blood vessel, which can lead to a stroke. Smoking, daily smoking a cigarette can lead to a blockage of arteries in the heart, also in the brain also, can lead to a stroke. Alcohol, chronic long-term alcoholism can lead to a stroke. Dehydration, reduced water intake can lead to a different stroke. Some strokes are common even after sudden neck jerk, or if you are doing massage of the head in the saloon, can lead to a sudden twisting of your neck arteries and can lead to a fatal stroke. You should avoid those practices. And diet high in salt, high in sugar, high in fatty acids can lead to a slowly damage to your blood vessels and lead to a stroke. So these are the various risk factors for stroke: lack of exercise, obesity, sitting on the chair. I think nowadays we all sit on a chair, so now it is considered sitting on chair is a new smoking. So it's equivalent to smoking if you're sitting for 8 9 hours 10 hours in a day. So the risk of heart disease and the brain attacks are similar as if like smoking. So you should be always keep on moving, don't sit on a one idle place, and keep on moving, and so that your body moves, your blood circulation happens very nice.
Wow, that's actually very insightful, Doctor.
Yeah.
Are there any other medical conditions? You already mentioned a few, but apart from that, is there any other medical condition that can increase the chances of a stroke?
Yes, medical conditions, as I told, uncontrolled diabetes, uncontrolled hypertension, high cholesterol. Sometimes, if you have old family history of heart disease or brain stroke, that can lead to a stroke to the other family members. Even heart attacks, if you have developed heart attack in the past, or cardiac arrhythmias in the past, or if your heartbeat is not regular, that can lead to a stroke. The clot forms in the heart and which is thrown in the brain, so it can lead to a stroke. So heart diseases also increases the risk of stroke.
Okay. And, when anybody witnesses someone having a stroke, what should they do immediately for that person who's
Yeah.
undergoing the
So,
stroke?
so first of all, make patient comfortable, and uh, call the hospital if first confirm it is a stroke, then if you confirm, if you know the symptom it is a stroke, then you should act immediately. You should call nearby hospital who has a CT scan or MRI facility and immediately take that person to that hospital without wasting any time, because you can't do much at house or at office to that patient. So don't give anything to drink when he is semi-conscious, because it may go in the lungs. So take that patient immediately to the nearby hospital which has a CT scan or MRI facility, so that we can recognize the stroke and treat it aggressively. So you should take to the patient in within minutes. You should go to the hospital. I will tell you what is the importance of minutes in this case.
Okay. Could you tell us more about the stroke golden hours?
Yeah. So yeah, the main question comes. So what is a golden hour in the stroke? So if you know it is a stroke, if your family member, friend, or colleague is having, if you recognize it is a stroke, it could be a stroke. So brain has billions of neurons. Your brain has billions of neurons. But if he develops stroke at consider 8 a.m. in the morning at house, and every 1 minute delay going to the hospital can lead to 2 million neuron loss per minute. 2 million neuron loss per minute. So every minute is important. So this golden hour, what is golden hour? So if you reach to the hospital within 4.5 hours from the onset of symptom, within 4.5 hours from the onset of the symptom, then that clot can be identified and it can be dissolved with a stronger injection like Actylize, or within 6 hours of onset of stroke, we can do a stenting or remove that clot mechanically. It is called mechanical thrombectomy. We go we do a digital subtraction angiography and remove the clot. So it can be done within 6 hours. But after 6 hours, it is difficult to treat or reverse the symptom of stroke. If you come in time, we can advise those strong blood thinner injection and we can dissolve the clot, so patient can have benefit from that. So this golden hour is very much important. So it should be patient should come to the bigger facility within 4.5 hours or 6 hours as early as possible. Consider, because every 1 minute 2 million neurons are lost. So if you delay taking patient to the hospital, your brain keep on get damage and damage and damage. So you may lead to a lifetime. You may be on the bed or paralyzed. You may not able to speak. And if you come in time, if you give injection and if you become normal, we have many young patients who came in time and we have thrombolized or given that injection. They got completely better. Now they are doing job in office, so they are back to their normal life. So if you don't come in time, then we may not help you to the 100%. So your life depends on your time, at what time you come to the hospital.
Okay, understood. And apart from the treatment that you mentioned, are there any other treatments also for stroke?
Yes. So other treatments of stroke are first of all, if you come in time, we give that blood thinner injection, and we can do mechanical thrombectomy within 6 hours. Or if patient come after 6 hours, so we start with the blood thinner medicines, control his BP, control his sugar, because it is a contributor factor to increase clotting. So to control the sugar, to control the BP, to keep his heart rate under control. So this treatment is very much essential. The blood thinner medicines are very much essential within first hour. But if patient is having bleeding, so if there is a rupture of artery in the brain, it is called brain hemorrhage. So the primary reason for brain hemorrhage is uncontrolled hypertension or uncontrolled blood pressure. In that case, we have to rapidly control his blood pressure to reduce the bleeding in the brain, so that patient can recover very early.
Okay. And what if the patient doesn't get the treatment?
Doesn't need the treatment.
He doesn't receive any treatment if he's not treated for
Yeah.
any reason. So then
In Indian societies, many reasons patient do not come on time. Patient come after, today only I saw the patient in OPD. She came well-to-do, educated, but she came after 3 days of starting of left hand weakness. She is very late. So it is very difficult to recover her arm now. although she is 70 years old lady. And if you don't receive treatment early, or if you don't even receive the treatment, so your body function may not return to the normal. You will be paralyzed for your life. You'll be dependent for every daily activities in life, to your dependent on your family member for feeding, for walking, for sitting. So you should take treatment, at least consult a doctor as early as possible, consult a physician or neurologist if possible. If you're getting neurologist nearby your hospital, so consult him immediately, because stroke may be devastating and it may make you dependent for your life.
Right. And once the patient receives the treatment, how much time does it take for them to recover?
Yeah, so very much important question. If this time depends on at what time you reach to the hospital after onset of the stroke.
Okay.
If you reach late, then recovery time goes to months or years. If you reach on time within minutes, within first 4 hours, the recovery time is very less. It may become, you may recover within few days also. So that recovery time depends on you when you come to the hospital or when you start the treatment. So that's why we are doing awareness campaigns about stroke, that golden hour is there, you should come early, so that patient will benefit in his recovery.
Right. And so we spoke about, what leads to stroke, the risk factors, the dietary habits. Uh, what can a person do to avoid, to reduce the chances of a brain stroke? What
Yeah.
changes can they bring
So
about?
as I told you, these are the risk factors. Now, the simple thing is we have to reduce the risk factor. Okay, so that your chances of getting stroke reduces in your future life. Like diabetes, you should keep on checking your sugar at least 6 monthly or yearly. You should keep on checking your blood pressure at least every monthly or 2 monthly, so that if your BP or sugar is very high, so it may immediately lead to a stroke in future life. So keep on checking that, keep on checking your heart rhythm, heart function, because the clot may form in the heart and it may go in the brain. Always reduce your weight, always do exercise, avoid obesity, avoid sitting on chair, keep on moving, and at least 30 minutes per day for 5 days a week. Exercise is enough to control your heart problems or brain problems. Risk factors: reduce your fried items or reduce eating high cholesterol content foods, fatty foods, like oily foods. And you can, if you have heart disease, if you have blood pressure, if you have high sugar, so blood thinner tablets can be initiated, which reduce the risk of stroke in the future life. Avoid smoking, avoid taking alcohol, and you should exercise regularly. That is, and stress. Nowadays, stress is one of the risk factor for stroke. So stress, migraine, headaches can lead to a stroke in future. So headache is also a very important risk factor for a stroke. Stress levels should be minimized with yoga, meditation, and drinking adequate fluids or water, at least 2 to 3 liters per day, is very much important. Many times you get dehydrated, you may develop stroke. So these are the prevention or taking care of your future stroke risk.
I think that's very helpful, Doctor. Just a last question before we start taking audience questions. Um, does COVID sort of make a stroke more dangerous, or can a person, because of COVID, be more susceptible to getting a stroke?
Yes, COVID has increased the risk of stroke. We have seen many stroke patients, even the clotting and bleeding is happening to the brain, because COVID virus itself triggers the clotting tendency in the body. It may lead to the clotting in the heart, clotting in the lungs, clotting in the legs, clotting in the brain. So COVID has very much increased the risk of stroke in such COVID patients. We have seen many COVID patients having stroke in spite of giving blood thinner medicines, still they develop a stroke. So COVID has very high tendency for formation of clotting in the body. So we give blood thinner injection during the COVID admission, but still it has led to many strokes to the patient, and it has increased the fatality rate in the COVID patients.
Okay. So moving on to the audience questions now. Somebody has asked, It's a very interesting question, actually. It says, can too much happiness or shock cause a stroke?
Pardon. Can you
Can
repeat?
too much happiness or a shock cause stroke?
Yeah, sudden stressful news or some death in the family can sometimes lead to a stroke, because it leads to a sudden increase in sympathetic tone. It may lead to high BP and lead to a brain hemorrhage or something. So sudden, not happiness, but sudden bad news can lead to a sudden increase in blood pressure, and brain hemorrhage or clotting can happen.
Okay. And then somebody needs to know, can we recover from stroke without treatment?
Yeah, this is less likely. Sometimes, naturally, we call it transient ischemic attack or TIA. Sometimes the body itself dissolves the clot. If the clot is very minute, less than 1 mm or so, 1 mm or 2 mm. So if the clot is very minute, then sometimes body itself take care of that clot and dissolve that. So patient develop transient symptoms and then recover from that. But that indicates body has tendency to form the clots. In next 24 hours, you should visit a doctor and start blood thinner medicines. Yeah. So yeah, that is very much important. So without treatment, recovery is less likely. You should take a treatment.
And this is about somebody's asked, what is the Indian stroke rate? I mean, how many
Pardon?
Indians? So they just want to know, in India, what is the stroke rate, if you have an idea
Yeah.
about?
So, yeah, in 100 in 100 people, 2 to 3%, 5% around can develop a stroke. So it's very common. Daily we see a
Very common.
2-3 stroke patient coming to the OPD. That's very high rate actually.
That is true. That is true.
Yeah.
All right. I think the questions are pretty much done. Great, doctor. I think this has been very useful for everyone who's involved, everybody who's watched. Thank you so much for joining us today, doctor.
Thank you, Bhavna. Thank you. Thanks a lot.